Good afternoon, everyone. Thank you for joining us today. I am Dr. Veronica Peniotu, and I am the Advocacy and Program Manager here at the National Coalition for Cancer Survivorship. I want to start by thanking our sponsors who make our programming possible. We are really excited to be able to bring together a group of experts to discuss the lived experience of caregiving and policies that can support them in the workplace and in the healthcare system. I get the honor to introduce my colleague and the NCCS Director of Public Policy, Haley Smoot. She is responsible for representing cancer survivors on Capitol Hill and with federal agencies and state governments to advance NCCS's policy priorities. Haley's passion for cancer policy and advocacy stems from her own personal experience as being a caregiver for her father who passed away from cancer in 2017, and her mother who was later diagnosed with cancer in 2019. As her parents' caregivers, she witnessed firsthand the challenges of the current healthcare system and the importance of quality cancer care. Thank you, Haley, for joining us today.
Thank you so much, Veronica. Hi, everyone. I'm Haley Smoot. As Veronica mentioned, I'm the Director of Public Policy with the National Coalition for Cancer Survivorship. I'm super excited to be here with y'all today. I think this subject is a very important one because as a former caregiver myself with both of my parents, I've seen the demands that can be placed on your family when a loved one is diagnosed with cancer. I'm incredibly excited to introduce our speakers today from Arcadia University in Pennsylvania. They'll be speaking with us about the demands placed on caregivers who care for loved ones with cancer, and they'll also share some strategies that employers and health systems can utilize to support caregivers. So first, we will hear from Dr. Margaret Longacre, Associate Professor and Chair of the Public Health Department, as well as Assistant Dean of Research for the College of Health Sciences at Arcadia University. Dr. Longacre's research focuses on informal or family caregiving, including understanding policy and health system impacts and caregiver engagement. We'll also hear from Mary Sweeney, Vice President for Human Resources and Employee Experience at Arcadia. She began her career in HR in 1984 in the banking industry and has held various positions with increasing responsibility since that time in healthcare and health education industries. And we will also hear from Michele Cygan, Director of Compensation and Benefits at Arcadia. Michele has spent over 25 years in HR, working in various markets, including healthcare, specialty pharmaceutical, clinical research, and higher education. So she brings a wealth of knowledge to her position. Now I am pleased to turn it over to Dr. Longacre to kick us off.
Wonderful. Thank you so much. I'm going to go ahead and share slides just to bring that up first. Well, it's such an honor and a privilege to be with you all today. And I just really want to thank the panelists for all of your work and effort and collaboration in putting this together. NCCS for having us and hosting us and bringing us here to talk about this really important topic of caregiving and career. And of course, all the stakeholders listening in as well. We truly appreciate your time and hope that this can be a collaborative discussion as well. And so we will be allowing time at the end for that. So again, thank you. And we look forward to this time together. So I want to start with just offering a bit of a centering thought or question on how can we assist caregivers today? And really, this is kind of where we will come together as various stakeholders to think about how we can unite to improve the well-being for caregivers in the oncology context, but even more so broadly. And so we know the value of caregivers, particularly for cancer survivors and the importance in their lives and the way that they assist and support in a variety of ways, which I'll talk about. But we also know their value for society, for our health system. And we know that they've been called the backbone of the long-term care system, invisible workforce, among other ways that we see the societal benefit of caregivers. But truly, we need to be able to support them best so that they can thrive. And so that's why we're here today, is to think about ways and discuss ways that that might be possible. And so many have invested so much time and effort over decades to improve the lives of caregivers in various settings and contexts. And so this is just, a contribution, a continuation of that work. So again, we hope that this can be collaborative. as we move forward. So how can we assist caregivers today? So as we go through the next several slides, the main points that we hope to cover are cancer and caregiving. We want to share the lived experience of caregiving in the cancer context. And then also, we're intentional about thinking about solutions and what some of those solutions might be, either right now or in the future. And the two spaces that we landed on are thinking about health systems, number one, and number two, employers. And so how can we make a positive impact for caregivers in terms of caregiving, but also for their careers, so that they don't have to always be choosing between caregiving and career. So making it so that all people can thrive either as a caregiver and have options and choices as they move along. I'll move through some of the first slides a little bit quickly, and then allow enough time for our panelists to also share. And so the first piece that I want to make sure that I'm reflecting upon is just the cancer landscape. And I, of course, know that many of you listening in are very familiar with this information, but it's important to reflect on the magnitude of cancer in the United States and globally. And so on the slide, you can see the statistics that we are well aware of impacting the lives of individuals, and always remembering that our statistics are individuals put together. And so we're thinking about the individuals, the families, the caregivers who are supporting as well. But we know the magnitude is great and it's increasing, and the survivors number is increasing as well because of the increasing aging population, as well as screening efforts that are occurring earlier. So diagnoses are occurring earlier. We also know that there's significant variations, and these variations occur by cancer type and progression. So we know that survival rates, though improving in many places and in many cancer diagnoses, are not as quickly improving in others. And then we also know, despite improvement in recent years, that there still continues to be stark disparities by race and ethnicity. And we're particularly evident and clear about the differences among persons of color and the higher mortality and death rate among Black survivors as well. And so we look to advance this particular area, and importantly, advance early detection and screening so that these rates are improving. We also want to talk then about caregiving and the magnitude of caregiving in the United States. And I generally have the opportunity to work collaboratively with the National Alliance for Caregiving over the last few years for different projects. And I've always appreciated the work they've done in identifying and categorizing caregivers across the United States for decades. So every 5 years, they do a national survey to identify the prevalence of caregiving in the United States. And so these are, we'll be sharing slides and be able to share the references as well, so that you can go to these reports if you're not familiar with them. But this allows us to see that in the United States, it's estimated that in 2019, there were 53 million adults providing care to an adult or child for health or disability reasons. And when we think specifically or look specifically at care for an adult, that number or prevalence is 47.9 million, an estimate. And on the screen, you can see also the demographics. So we see we have varied gender, race, ethnicity representing caregivers in the United States, and differences according to education levels, with 68% had some college or more. And we're also seeing more people providing care to one or more persons. And that's especially evident among younger caregivers, which is relevant to this workforce discussion. So specifically in, in oncology, what does it look like when we talk about the number of caregivers in the United States? And we don't fully know the best estimates yet, but one of them was looking at the National Alliance for Caregiving data and looking specifically at those who indicated that they provided care for cancer primarily. So, but the primary reason was was cancer. And as you can see in the slide, 6% of that larger sample of caregivers from the National Alliance for Caregiving data indicated that the primary reason for which they were providing care was cancer. And so that equates to about 2.8 million people. And again, this report was in 2020. Now that's likely an underestimate because that's the primary care reason. And knowing that there's comorbidities and that there's someone that might have indicated that the primary care reason was something else, but also the person that was receiving care also had a cancer diagnosis. So we anticipate that number is much higher, particularly given the numbers that I shared on the previous slide. And again, you can see the demographics for this population of caregivers in oncology. And this data was from our Cancer Caregiving in the US report from 2016. So these data are a little bit older, but it allowed us to see, again, variations with respect to race, gender, and education levels. But here we again see that 50% of those who indicated providing care to someone with cancer were employed. And then also that nearly 40%, 38% were providing care to a cancer, who are providing care to a cancer survivor were under the age of 65. So again, important for this conversation on how do we enhance the well-being of caregivers, but also specifically do that through more support in the workforce, as well as through the health system and a career. So what does the care experience look like? It's varied, and it depends on the caregiving context in which you are in, but there are some similarities across caregiving contexts. So for the reason to which you provide care, similar and common tasks might be providing practical support, providing assistance in the home, and keeping up of the home and finances, medical and nursing support. But also we see across caregiving contexts or reasons for care that caregivers are often involved in roles such as communication, advocating for the care recipient, making treatment decisions or care decisions with the care recipient or cancer survivor in this case, and also planning and thinking about the future and the current needs. They also monitor symptoms and side effects, and so they're regularly part of that interaction with the healthcare team. There's also important considerations within caregiving. So there are variations depending upon the reasons for which you're providing care. And even within cancer, there's specific differences depending upon the cancer type. Some of those differences relate to our increasing understanding of sociodemographic variations, social determinants of health, and the availability of resources and life experiences outside of the care context that might impact one's ability to provide care, and certainly work is one of those. But we are starting to see a little bit more and looking closer at the data with respect to sociodemographic variations and the care experience, including in cancer, and seeing that Black and Hispanic caregivers are being shown to have more caregiving tasks, provide more care hours over the course of the week, which is already high for many of all caregivers, and have more financial strain, but also experience higher levels of social support. So again, there's variations that we're seeing, again, in the type of caregiving that you're doing, from Alzheimer's disease caregiving to oncology caregiving, but there's much more work to be done there. Specifically within cancer, we know that all caregiving within cancer is determined and shown to be highly demanding, highly stressful, and have many tasks and burden and many tasks associated with that level of care. But certain cancers also require different forms of assistance. And head and neck cancer is one of those forms of cancer that does require significant contribution and support to the cancer survivor. And we'll be hearing a little bit more about that experience as we go forward. We also see differences in strain among those who might be providing care to children in the home, as well as providing care for reasons for health or disability. And these we call the sandwich generation caregivers. They're experiencing both levels of care and are about 11 million individuals in the United States. And just noting the report here on the screen was also conducted in part with National Alliance for Caregiving, and that's a good resource to identify and understand that level of strain for caregivers. So importantly, we want to think again about how we can make a positive impact in the lives of caregivers. And we have to understand where the strain might be. And for caregiver well-being, there's several constructs and dimensions. But on the screen here, I have just a few that I want to reflect on. And these are some of the findings that we know specifically in oncology of what might be stressful and straining for caregivers. We do, from that National Alliance for Caregiving in the US report, we were able to see that caregivers in oncology compared to non-caregiving oncology caregiving context had higher levels of stress. There was a higher proportion, about 50% indicated the highest level of stress as a result of caregiving compared to the non-cancer caregiving group, which is about 37% indicated that highest level of stress. Numerous reports have indicated elevated strain from emotional strain and anxiety and depression. And we also see that there is evidence of social strain as from limited social interactions, and then also physical impacts as well. So there are greater use of health services among caregivers compared to non-caregivers. So we want to consider that as well. And then what we're really thinking about here today is the financial burden. And so how that is impacted with our work and our ability to provide care. And so on the screen here, you can see the financial and career strain in caregiving. And when you look at the different components of financial and career strain in caregiving, you can see that survivors and their caregivers are experiencing financial burden from medical out-of-pocket costs. This is in the form of cost sharing, burden due to treatment and multiple treatments, prescription drug costs, loss of insurance, potentially among the survivor, and even the caregiver's own medical bills. And then we also see the medical, non-medical costs adding up over the course of a survivor's treatment and plan over time. It might be things of traveling for treatment and assisting, hotel, gas, parking, public transportation, having more assistance in the home and needing to pay for that, and even childcare. And then there's also the income loss that is experienced, which is reduced hours in work, foregone promotions, and also quitting or retiring early due to and reduced savings over time. And these are the career impacts that we see across the board in caregiving and not just in oncology as well. And then lastly, absenteeism and presenteeism is just the likelihood that the caregiver might be in the workplace, but also not as productive as typical in some contexts. So these are just some of the financial pieces of the care experience. And so we're going to talk about, again, going forward, the solutions that are in mind about how do we then address these concerns for someone supporting a cancer survivor and how we can improve that. So next, we're going to hear from Dr. Christina Sisti. Christina, thank you so much for being with us today and your willingness to share your story. You are a cancer survivor yourself, having been diagnosed with invasive ductal carcinoma, and also provided care for your husband, who was diagnosed with head and neck squamous cell carcinoma and passed away sadly in 2019. We so value your willingness to provide your story and your reflection of your experience. So thank you for being with us.
No, thank you. And I appreciate the opportunity to share my experience. So my husband was first diagnosed with head and neck cancer in 2017. And he went through chemo and radiation for head and neck cancer is a one-shot deal because it does so much damage to the throat. When he was declared, there's no existence, we can't find any evidence of disease, it was a celebration because he lost 50 pounds. He was in and out of the ICU at least 2 or 3 times, multiple day stays. He couldn't swallow at some points and lost all sense of taste. He even lost some hearing because of radiation. Watching him go through that was gut-wrenching, horrible, heartbreaking. And I don't know if I could ever really recover from that. But when we found out there was no evidence, we thought, okay, this is it. A couple months later, I was diagnosed with stage 3 breast cancer. So we went through that. And we went to Moffitt Cancer Center in Tampa for my treatment because I wanted a second opinion. So I had a meeting with an oncologist in my area. And then we went up to Moffitt, which is about an hour or so away from us. When I finished chemo and radiation and my mastectomy, we thought, okay, we're good. It's okay. 2 months later, he was re-diagnosed in August of 19 with metastatic head and neck cancer. And at that point, there's no cure. So we knew that what we were doing was just putting Band-Aids on with the hope that maybe at some point there'll be a clinical trial that'll work. He decided he's going to go to Moffitt because of the experience that he saw with me and with the care that they give, which was a blessing. I didn't understand how intensive dealing with head and neck cancer at the metastatic stage would be, could be, and is still. He went through multiple clinical trials. He had chemo that it knocked him down. He couldn't at some points even swallow. He couldn't eat. There were times when he was just so sick, he relied on me to help him walk. And as his disease progressed, it was eye-opening to realize just how much time and care is really needed for someone with head and neck cancer, and I'm sure with others as well. But what I did learn is how to be an advocate, how to help him go through the process of this is what a clinical trial is, this is the steps. You don't have to go through this. If you don't understand something, you can ask. Informed consent is absolutely essential. But I also established him with MD Anderson, with Mayo, with Johns Hopkins, because if there were to be a clinical trial at their institute, he would be on the fast track. So they also worked with our oncologist at Moffitt. Anytime we were up at Moffitt, it seemed like it was at least 12 to 14-hour days. When he started progressing and getting sicker, we spent so much time traveling to get up there to take him to the emergency room because it was the safest place and they understood how to treat his cancer. We had multiple long-term stays at Moffitt. I don't think anyone really realizes how much this breaks you down until you're going through it. And I know I probably speak for some other caregivers when you say there's so much involved, time, energy, mental and physical wear. And that's just partly on me and partly on him, because of course he was feeling guilty that he's putting me through this while I was still going through different surgeries. But it didn't matter. What I knew that we needed to navigate the systems of care. We needed to figure out what can we do to make this easier on you. And we also needed to acknowledge that there are emotional demands. There are emotional drains, physical drains. And when COVID hit in 2020, he had just come out of the intensive care unit and everything shut down like the next day. So we were already socially isolated. Being socially isolated during COVID was nothing new. To us, it was just like, okay, we're already doing this. But it was draining because all of a sudden you realize, okay, I thought I could handle social isolation, but I'm really isolated. I can't go out. I have to be careful that people are wearing masks. I have to avoid certain situations. I have to make sure that he's safe because I don't want to bring something in. Physically, there's no time. There's just no time to do anything, especially as the disease is progressing. And he relied more and more on me to take care of even the little things, glasses of water, get him food. He couldn't get up half the time. And then at one point, he fell and he couldn't get up. He had to be picked up, lifted from the floor. And that happened 2 different times. And you start to realize, okay, I don't know if I can do this by myself. I don't know if I can pick up a grown man. So what do we need to do? We looked at bringing in palliative care. He didn't understand what palliative care was. He thought it was hospice. He thought we were saying you're dying. So he put it off. But that meant I'm now still doing all of this. I'm making sure he gets a bed. I'm making sure he's showered. I'm making sure that he's eating, that he's making sure that he puts his thickener in his water because he was aspirating. And you learn a lot. I feel like at the end, I was almost an oncologist. Not that I was, but you get that feeling that you're just like, I understand how to find clinical trials. I understand how to navigate this. I understand your language. And I also understand that I'm alone. There wasn't a network of caregivers that I could tap into until I found certain organizations that dealt with head and neck cancer support and caregiver. But also, when you think about everything that you're doing, you also look at, okay, we have demands, we have these costs, we know the emotional toll, we know the physical toll, we know the social toll, but financial toll, which was said already, it does cost a lot. Now, we had to go up to Moffitt a lot of times, and we would have to get a hotel room. You have to pay for gas. We tipped the valet because it was free parking at Moffitt, but the valets are college students, so you tip the valet. Plus, it's just the right thing to do. You pay for prescriptions, and some of those prescriptions were $500 or more and weren't covered by insurance. We had to pay for medical equipment. We had to pay for his deductible. We had to pay for just, there's so many out-of-pocket costs that nobody tells you about, all these little things. We had to pay for the thickener for his water, which you don't think about. I mean, who thinks, oh, I need thickener for water? But then you have to find that too, by the way. That's not easy. But I will say that this is also where going to a comprehensive cancer center does help, because they will help you find, this is where you can find thickener. This is where you can get this. And they will do everything that they can do to put you in touch. What I needed to do, though, is I had to put aside my work. I lost my contracts. I lost all the organizations that I was working with because caring for him was a full-time job. So I had to turn to freelancing. And that does make a difference when you're starting to look at all these other costs that are adding up. And now you're no longer pulling in the same salary that you were. I don't think people really understand the full cost navigating care, trying to learn the lingo, trying to figure out, how do I do this? When can I get them here? And if you're going to a center that's not a local center, then you have to add in that much time. People don't understand just the physical, the emotional toll, the work that everyone has to do, the patient and the caregiver. So addressing the needs of caregivers, addressing how employers can help, addressing how social well-being, physical well-being needs to be considered when you're looking at how to help caregivers. I feel that that's important, and I really appreciate this meeting. Thank you.
Thank you so much for your story. And it's so meaningful to hear your reflection and the experience that you had, and your willingness to share that with us, because I really think it speaks going forward to some of the solutions that we were really hoping for, particularly from the health system and also within employers. And so The solutions first will be related to, again, the health system and employers, but why are we thinking about both of these spaces and why together? The thinking is that these are places for regular contact with survivors and their caregivers, both within healthcare systems and then also among employers. And there's the potential to improve outcomes for caregivers and survivors alike. And so if we intervene and provide support, it can improve outcomes for the caregivers in terms of their long-term health. This is a major public health issue because they might be more likely to use health services going forward and have poorer health outcomes in the long run. So if we can intervene early and assist them in their financial, social, emotional well-being, it might ultimately then improve their health long-term. There's also evidence that there's a dyadic relationship, particularly with quality of life and aspects of distress between the caregiver and survivor as well. So ultimately, it could then be a positive outcome for the quality of life of the survivor if we're intervening and assisting the caregiver. And then also in both health systems and in among employers, there's the opportunity to see the benefit of it by decreased spending. Now that has not yet been proven, but those are things that we are starting to look at is if we intervene with caregivers and see outcomes improvement within their own health and then also among the survivor, does that actually result in savings or efficiency within our health system and even among employers? And so these are interrelated as well. And so one of the areas that I've spent time working in is just looking to integrate and involve caregivers in the healthcare system. Like we just heard from Christina, the value of that within her experience of being recognized when providing support. And we can't do that. We can't ask caregivers to be involved at that level if they also can't find ways to have flexible work schedules or modify their work. And so that's what I say that it's interrelated with respect to integrating and involving caregivers in the healthcare context, but also the importance of having them supported in the among the employers. So just briefly, what I did is I put together just a few of the ways that I think that health systems are and will continue to support caregivers going forward. And one of them is adopting a person and family-centered model of care. And specifically engaging caregivers, recognizing their needs and resourcing them. And some of the recent evidence, including an article from NCI, is saying that we really need to be especially attentive to the financial toxicity and the burden experienced by survivors and caregivers within that assessment and within that screening. And so many of the diagram or the images on the screen show you the thought leaders across the last several decades in terms of engaging caregivers in the health system. And so this is not necessarily a new thought, but the implementation is becoming much more active. And so that's particularly related to the CARE Act through AARP. And so that says that within states that have passed this, that a caregiver needs to be identified in the electronic medical record, trained, and then informed if the care recipient is discharged home. And so these things have important implications for involving caregivers more readily in interactions and communications and identifying them as part of the care team. And so there's much research going on, including some of the work that I've been doing with colleagues at Fox Chase Cancer Center on integrating caregivers through the patient portal system or different strategies to engage them specifically, identify their needs, and resource them. Two other ways that I think that we can be thinking about our health system for better caregiver involvement is really through COVID, understanding the use of telehealth and ways that has actually supported caregiver involvement a bit more, especially with respect to employment and being able to not have to take off an entire day of work if you're engaged in that telehealth visit. And so this is something I believe we should continue to think about going forward, not only with respect to the convenience and quality for the cancer survivor and making sure that it is of high quality, but also seeing the potential benefit to the caregiver and the caregiver engagement as well, and ensuring equity in that access to technology. And then lastly is just ensuring comprehensive, equitable care. And we heard that a little bit with Christina's experience, is that too often experiences vary. So making sure, and that really is, I believe that one of the founding purposes of NCCS is making sure that everybody has access to quality care. And when survivors have access to quality of care, that improves the outcomes for caregivers as well. So really recognizing how we can be supporting caregivers through the health system going forward. There's many ways that we can be doing it. And I know there's challenges. Trust me, I know there's challenges with doing this, but I think it's worth continuing to push and see what ultimately are the benefits of this, and what are the needs among health systems as well. So again, the other space is assisting in employment and careers, and specifically helping as an employer. So I'm going to pass this over to my colleague, Mary Sweeney, to introduce some of the things that we've been doing to support caregivers.
Great. Thanks, Maggie. So as we came together and started to think through solutions, we broke out into two categories: employer, what can the employer do? And then also, what can the employee do? And so we created checklists. We like checklists. And so we created two checklists that we hope will be helpful for caregivers. And those checklists will be available along with this video at the end of this webinar and out on this website as well. So again, a couple different places that you'll be able to access these checklists. We're going to review now first the employee area, which I'm going to hand to Michele Cygan, and then I'll return back to talk about the employer checklist. Michele?
Thanks, Mary. Next slide, please. So first of all, what I'd like to say is, as a comp and benefits professional, I have learned so much from working with this team in the last month that we've been working together. So if anything, your voices have been heard by me, and I will share this experience with other comp and benefits professionals. Like Mary said, we broke this down by employee, what can employees do and what can employers do. So I'm going to focus on employees, and that being you as a caregiver. You find out about this news. Christina indicated she found out the news of, her spouse just navigating care, the emotional and the physical drain. You definitely go through a lot of change. So I'm going to kind of focus on some things that how you can address how to move forward. So first of all, I recommend that you schedule a meeting with your human resources team. That is, if you have an employer, maybe above 75 to 100 employees, there'll be an HR, responsible person. Of course, large organizations always have a human resources department. The reason why I say schedule a meeting as early as possible is you have just been faced with all this news. And the best thing to do is sit down with those that are the professionals. So you should schedule that meeting. And then the second thing, talk about the benefits of the person that you're caring for. First of all, review to see if you have access to an employee assistance plan. Many large providers and some small providers do provide employee assistance plans. And with these plans, you can meet with a professional, and they are all about helping you manage change. Some people think of an employee assistance plan, oh, that's just for counseling. That may have been years ago. But now, in addition to meeting with a counselor to help you manage change, they also provide support in terms of caregiving, babysitting services. So they typically, if they have a website available, they have all types of literature and all types of programs. So that's what I recommend, meeting with your HR person and next with someone from your employee assistance program. Also, next, you should take a look at the medical plan benefits. As Christina mentioned, you know, a lot of the care, of course, will hopefully be covered by your medical plan, but there will be some things that will be out of pocket costs. So the first thing you want to do, and I've heard, you know, loud and clear from Christina, is you have to consider the care recipient's needs. You know, first she noted that her husband went to, you know, a certain hospital for clinical care. Then she went to another hospital and her husband said, hey, I want to go where, you know, where you went. So it's all a learning experience. But when you're taking a look at your medical plan, you want to take a look at the in-network benefits versus out-of-network benefits. So you want to kind of, what you're going to do is make the decision, first of all, you know, look at the providers that you have available to you and the best place to seek care. Now, if you do utilize in-network benefits, of course, you'll find some savings there. And then those savings could possibly use for some of the other expenses that Christina mentioned, like parking or, you know, just those additional traveling expenses. And a big thing, Maggie, thank you for mentioning that. We try to educate our employees on utilizing telehealth. It will save you time. It's going to save you money. You don't have to drive to an appointment. So as much of those, you know, check with your specialist and say, do you offer telehealth program? Another part with a medical plan, something you may want to ask is, does the medical plan have something like called a nurse navigator or a nurse manager? Sometimes they have these individuals in place that will help manage your care. So they help coordinate the care between all the different specialists that you are going to be working with. The third thing here we have is adjusting your work schedule. So Mary will talk a little bit about, you know, FMLA you probably heard of, and state leaves. You may not have heard of that, but I'll leave that for Mary. But in addition to FMLA and state leave programs, you should really talk to your employer about programs that they may have available to support you. First of all, of course, you're going to take a look at your time off that's available. Make sure you check what are your time off balances that are available to you, and how can you best utilize them. Some policies allow you to take it in half-day increments, hourly increments. So you want to take a look at the policy, so when you're coordinating your care, you can kind of see how you can utilize those days. Some employers offer a paid time off donation program. I typically see this at larger employers. What that is if an employee does run out of time off, employees that have excess time off donate their time off to this program, and it's available for those employees in need. So just a question to ask your employer. Also, inquire about flexible work arrangements. What's really great for caregivers today versus a few years back is COVID. If we could say there's a positive of COVID, there aren't too many, but one positive is creating flexible work arrangements. And what I mean by that is those positions that typically were in the office every day, working from 9 to 5, we have proven all over the world that we can now, through the technology that we have available, provide more flexible work arrangements. And because of COVID, employers, HR professionals are attending plenty of webinars that have been in existence since COVID started and still continue regarding flexible work arrangements. And the best employers are going to offer very flexible work arrangements so that they can retain the talent that they need. So some of the things you can look at is, can you consider going from full-time to a part-time status? Can you change your work hours? Can you flex them? Sometimes you'll see flexible work hours. You can start between 8 and 10 a.m. and you can end, you know, between 5 and 7, or there's certain core hours that you need to work. So you should check on that. You can also inquire about working remotely, you know, perhaps even if it's on a temporary basis. Say, this will really help me on Tuesdays and Thursdays when I need to coordinate care. Since I'm a caregiver, can I have flexibility on those days? I always say there is no harm in asking. Even if you meet with your HR person and they don't have policies in place, I say push the button, just say, I've been with this company and, I enjoyed working here and I really need your support for me getting through this. We also talk about here, consider financial supports. So we listed here flexible spending accounts. If you're not aware of these are accounts that employees set up each year. You set aside monies on a pre-tax basis, and they cover healthcare costs, dependent care costs. There are also other plans called a health savings account, health reimbursement account. These will be included on the checklist. We didn't want to put everything down on here, but these are definitely included in the checklist. And also some other things that we'll talk about and are listed on the checklist are checked to see if the person that you are providing care for, does their employer provide any benefits such as voluntary life, long-term care, critical illness, or hospital insurance. You'll see these insurance plans listed. And if they have that, you will definitely have benefits that will be available to the person, who is receiving care. Planning for future caregiving. One thing that we have all learned, I learned through this, but also, Christina said she learned is not if you're taking care of a person, you're a caregiver now. And, hopefully things you'll have a speedy recovery for the person. But it helps you think about your future. So what we were focusing on here is plan for future caregiving, or even me, after learning about some of these, the information that I learned from this group is, take advantage of your open enrollment periods. Open enrollment periods are held by employers every year, and take a look at some of these options that we had listed here. Of course, you want to consider engaging early in retirement planning options. The reason I say that is there are sometimes some hardship withdrawals that are available through retirement plan options to support, extreme medical costs. Also, you can consider, these are mostly voluntary programs that some employers may offer. Additional life insurance, long-term care insurance, critical illness, which covers, cancer is typically covered and lots of other critical illnesses. Hospital insurance. Hospital insurance plans typically will cover you for certain days, if you are in critical care versus, a regular hospital stay, they provide additional benefits. Also, you can explore Social Security benefits. And also in cases, whereas, the continuum of care will be long, take a look at early payouts that may be available on employer life insurance plans and retirement plans, because those options are typically built into 401k, 403b plans, plans that are typically available to employees. Mary?
So I will jump in now and talk about the employer checklist. And by the way, both of the checklists have also been placed in the chat. There's, as I said earlier, one for employees and another for employers. I too, like Hallie, had both parents diagnosed with cancer overlapping time. And I very clearly remember being with my mom one day thinking, when I retire someday, I'm going to volunteer my time because this is so complicated, this insurance, how to maneuver through the healthcare system. And so again, as Michele and I approach the employee and employer checklist, we wanted to also talk about this from the employer perspective. And some of the things we identified is that we as employers need to have a culture of empathy, right? We want people to be able to think about their employees and be able to walk in their shoes. And we believe that that's modeled by leadership. So starting at the top with executive sponsorship, empathy, and a culture of caring is critical within an organization. Michele just talked about the flexible work arrangements. Again, there has to be a support at the top and a commitment to allowing colleagues to have those flexible work arrangements. Michele also talked about the PTO donation program. Many employers are doing this, and this really helps colleagues and caregivers at the time when they're most in need. And colleagues or peers really want to be able to help. And so PTO donation, if it's offered through an employer, is a great benefit to both the colleague that is sick, but also for the caregivers. Employers may also establish employer relief funds, emergency relief funds. Something, as Christina talked about, kind of just hitting the point where a lot of money is going out of your pocket that you weren't anticipating, and really needing some additional funding for short periods of time and for the true case of emergency. Again, nice employer benefit to offer. We might want to be thinking about too, as employers, just providing centralized caregiving support specialists. Again, you likely would find this more in your larger employers, but many employers today are focused on the colleague health and well-being, and that expands out to caregivers as well. Some of the core benefits Michele alluded to, and many employers have to offer, are the Family Medical Leave Act, and that is offered through employers who have 50 or more employees. And then it does get a little tricky, but there are also state or local locales that also may offer paid leave. So once again, check the state in which you live or the locale, the city in which you live, and you may find that there's additional paid leave within those vicinities. And then both Christina and Michele talked about the importance of having comprehensive medical and prescription plans, really making sure that you're thinking about these plans in a pretty thoughtful, comprehensive way, and that you're considering your employees at the end. From the voluntary benefits and financial wellness, Michele alluded to these as well, so these are a little repetitive to what Michele just talked about, but long-term care insurance, critical care insurance, and remember that some of these have real specific insurance mechanisms for cancer, for example. And so considering what options are out there and doing it early enough in the benefit planning time. And then finally, and Michele did talk about employee assistance programs. I'll just echo what she said. I think that employee assistance programs have really expanded a lot in the last 15 years or so to be much more supportive and helpful to employees in need, to our colleagues in need. And then we heard Christina talk about reaching out and finding support groups through different networks. You might find that there's support networks within your employers also. And then just mentors, right? Just peer mentors. And once again, that executive sponsorship at the top, making sure that we're there to care for both our colleagues and for the caregivers who take good care of them. And I'll just say one more time, the checklists are pretty comprehensive. We'll cover a lot of the things, but Michele and I just covered are in the chat and will also be distributed along with the webinar video. And with that, I think we move to questions and answers.
Thank you. Yeah, thank you. I think we'll kind of open it up for discussion going forward. Opportunity to ask specific questions, and then again reflect a little bit more on these checklists. I think each of us here at Arcadia, we were thinking when we were putting these together that these would have been very helpful when we were all in the caregiving situation as well. So hope they're of value.
Great. Thank you guys so much for sharing this presentation and strategies and resources. As y'all mentioned, we have the checklist in the chat and we have a few minutes left for questions. So I'm going to throw those at you guys. So the first question we had was, and I think Sandy Finestone alludes to this too in her question, that some employers don't offer as many benefits as others, and what can individuals do to encourage employers to implement some of these HR policies that y'all discussed?
I'll take that one. Mary and I talked about this a little bit yesterday, and really the biggest thing you can do as an employee is talk to your HR department saying, can you support these programs? FMLA is unpaid. Is there anything that the employer is doing? If anything, maybe the employer is not doing anything, but it'll put something in her mind, say, just like today, wow, this is a learning experience. If an employee came to me, I talked to Mary. What you can do from an employer standpoint, and what I've done only at 2 employers, so it's moving very slowly. However, at 2 of my employers, we did implement paid FMLA. One place they did it for 2 weeks and another for 3 weeks. So it's really, the testimony that I heard today from Christina and from this group is enough to make an employer or a benefits professional think about, what can I do with my plans to help support these individuals?
And I'll just add one to that. As a small employer, there may be consortiums which provide benefits or the opportunity to buy into plans that you might not be able to otherwise because they're too prohibitive. So check the local consortiums. Those are much more reasonable for small employers.
Great, that's really helpful. And I will jump to our next question that we received, and I'll direct this to Maggie, but please, y'all feel free to answer this too, everyone. So what role can community health workers play in supporting caregivers?
Yeah, so I did see that there in the chat, and I think community health workers can be contributing to the resourcing and information. So we can't do this in silos. So it does take kind of having collaboration within the healthcare systems and kind of resourcing out to our community, including community health workers and our advocacy organizations that have great resources available. So it's building those collaborations and connections and helping someone kind of navigating that cancer experience as a survivor, but also as a caregiver as well. So I think one of the places would actually be establishing some very specific training for community health workers with respect to caregiving would be wonderful.
And if I may piggyback on that, community health workers, they can play a huge role, but I think having the patient understand what a community health worker is. In my case, my husband thought if I was bringing in palliative care, it was hospice. And to have to go through and explain that, it's still heartbreaking for me because I brought him up to Moffitt's ICU on Halloween of 2021. The day before he finally agreed that yes, palliative care, having community health workers come into the home would be a good idea. November 4th is when he passed. So could this be done? Could it be explained better? Yes, because I do believe that community health workers play an important role when it comes to caregiving.
And I'll just add in, Christine, because that's such an important point of bringing in palliative care and how early, we are able to have that conversation, and the support to the caregiver then is really vital. And you're right that it has been too often confused with hospice, but the palliative care process started early can be a really beneficial experience for both the survivor and the caregiver, ideally. So that is a great point.
Great, thank you so much. And it looks like we're already out of time. This was such a great presentation. Thank you all so much for taking the time today. And thank you to our audience for joining us and for all of your great questions. I believe we did get, I think, to every question, but so that's great. Way to go, us. But anyway, Maggie, Michele, Mary, we really appreciate you sharing your knowledge and expertise. And thank you so much, Christina, for sharing your personal story today as well. So I also wanted to thank our sponsors for their support that help us bring these webinars to you. And again, we will share the slides and recording as well as the checklist that were discussed today during the presentation. They'll be posted on our website as well for you to access. So thank you guys so much. Thank you everyone for joining, and I hope you all have a wonderful day.
Thank you.
Thank you.